Everyone. My name is Hannah Vaughn, and today I'll be talking about some of the most common myths surrounding gestational diabetes, and more importantly, the facts that kind of clear up the confusion. So let's get straight into it. So first, let's talk about number one, why addressing misinformation matters. So when it comes to health, misinformation can lead to confusion, which then causes unnecessary fear and even unsafe decisions regarding health. So today, our goal is simple to take some of the most common myths regarding gestational diabetes and breaking them down and replacing them with evidence-based facts that you can trust. So, we should probably first break down what is gestational diabetes. So, let's start with the basics. Gestational diabetes is a type of diabetes that only occurs during pregnancy. It's usually in the second or third trimester. But pretty much what happens is when hormones are released by the placenta, it causes insulin resistance, meaning your body can't use insulin effectively. And that leads to higher blood sugar level ranges. And while it often resolves after delivery, it still requires mothers to manage it carefully during pregnancy for both safety of mom and baby. So, myth number one, eating too much sugar before pregnancy caused my gestational diabetes. When in reality, gestational diabetes is caused by, like I said, the hormonal changes during pregnancy that make your body more resistant to insulin. Pre-pregnancy weight may affect your risk, but sugar intake isn't the direct reason or direct cause. And the truth is, anyone can develop this regardless of weight or diet. All right, myth number two, if I have gestational diabetes, I can't have sugar or carbs in my diet at all. Wrong. Carbs are actually essential for your baby's growth and energy. The key is choosing those more complex carbs, so fruits, whole grains, vegetables, so not those simple sugars like candy, stuff like that, processed foods. Instead, finding a balanced diet, and then also balancing them with protein, healthy fats, not eliminating them completely. All right, on to number three. Gestational diabetes isn't serious because it just goes away after delivery. So, uncontrolled gestational diabetes can have serious consequences. For mom, it increases the risk of C-section, preeclampsia, and future type 2 diabetes. And then also, it has some risks for the baby. It can lead to large birth weight, breathing problems, or low blood sugar during birth. So yes, it can go away, but it still needs to be taken seriously. All right, number four. If I have gestational diabetes, I will definitely get type 2 diabetes later. Your risk is higher, but it's not guaranteed. That's why we talk about carefully managing it. So a healthy lifestyle after pregnancy, balanced eating, physical activity, and then maintaining a healthy weight can significantly lower that risk. And then on to number five, if I have gestational diabetes, I'll have to go on insulin. When the fact is, many women can manage it on their own by eating healthy and regular physical activity. Some may need medication or insulin, and that's okay. The main priority is keeping both mom and baby healthy and happy. Number six, if I have gestational diabetes, my baby will be born with diabetes. When the fact is, babies are simply not born with diabetes, even if their mom had gestational diabetes. With proper management, we can prevent complications during birth and also help ensure a healthy starts. Number 7, I only need to check my blood sugar when I feel bad. No. So gestational diabetes can actually go a lot of the times without having any symptoms. Um, they cause silent spikes, is what they refer to it as. That's why regular monitoring is so important. It helps catch those changes before they become a problem later on. All right, number 8. I can't breastfeed if I have gestational diabetes. That's not right. Not only can you breastfeed, but it's actually encouraged. Breastfeeding actually can lower the risk of long-term diabetes in both mom and baby. Myth 9, if I'm thin or active, I can't get gestational diabetes. We kind of touched on this earlier. Anyone can get this. So a healthy lifestyle can lower the risk, but it can still happen to anyone due to those hormonal changes, age, or genetics. Number 10, if I didn't have gestational diabetes in my first pregnancy, I won't get it again in future pregnancies. The fact is, every pregnancy is going to be different. So, up to 50% of women who had gestational diabetes before will develop it again in future pregnancies. And that's all the myth and facts. Key takeaways that I want to highlight for throughout the presentation. Gestational diabetes is widely misunderstood, and these myths can be harmful. Um, Diet and lifestyle choices are very important and can seriously help reduce risks both during and after pregnancy. Managing gestational diabetes is crucial for the health of both mom and baby. And always talk with your healthcare provider if you have any concerns or questions. And then if you want to learn more, you can check out trusted sources like CDC, American Diabetes Association, MyPlate's pregnancy guide. But you can also connect with a Peapod dietitian. Our email, website, and Instagram are listed right over here. Um, yeah, thank you guys so much for listening today. Here's the websites for those sources. Um, Again, my name's Hannah. I've had such a good time learning about this topic, getting to dive into it a little deeper with you guys. I hope you have an amazing rest of your day.